possiamo iniziare. Ma chi? So good morning, everyone. Welcome to our first innovation talk, organized by Assolombarda, of course, together with the Italian pavilion. And thanks for hosting us to the commissioner, Mario Vattani. And thanks to our president, Alessandro Spada, president of Assolombarda, for letting us organize this initiative here. This will be the first of 3 events we will be organizing here in Osaka with the intent, with the aim of creating a bridge between our region, between Italy, between Lombardy region and the Kansai area and Japan, on topics which link us really deeply, that start from society, from future trends, and one of these for sure is the demographic change, which is affecting countries, developing countries all over the world. We know we are going through a process of change with improvement, continuous improvement of life expectancy, which is impacting everyone in a positive way. But of course, we need to work on research and we need to work on social policies as well to make our societies healthier and make our societies sustainable for the future. Italy and Japan are both linked by this trend. Here the population is aging faster than ever. We have 30% of over 65 here in Japan. In Italy, we are around 24%. So we are very similar. We are also very similar in terms of habits, in terms of history, in terms of culture, and in terms also on the presence of 2 areas we call blue zones, which are the one with the most over 100 years old population. So people that are able to live longer, to live healthier, and we need to learn from them on how to be healthier and live longer ourselves. But of course, research and life science research is a big part of this process. So this is why we decided to concentrate our first innovation talk on life science research, and the title, The Art of Longevity, in a sense is the art of life science research to make us really a longevity society. So thank you again for being here, and I would start with our first speech from President Alessandro Spada, from Commissioner Mario Vattani. So please join us.
Thank you very much. It's not, you are right, mine is not really a speech, mine is a welcome. And for the sake of those who are outside, because as a matter of fact, just so you know, the many people who are lining up now in front of the pavilion and our friends, our visitors, can actually join us in this meeting, because this meeting is currently also broadcasted outside on our screens. Why do we do this? Because this is a very important theme, as a matter of fact. You have all seen as you arrived here that our pavilion enjoys a certain number of visitors, a lot of curiosity, and we're very happy for this. And we also have a lot of collaboration with other pavilions who decided to tell a very important story, to tell their story in Expo. I'm very happy to welcome today actually some of my colleagues. I can see the director of the US pavilion, which is also very, very visited and has a wonderful visitor experience. Now, talking of visitor experience, we decided to divide our visitor experience in mainly 3 parts. You have, at the center, of course, you have the universe, which is represented by the Farnese Atlas, a 2,000-year-old Roman sculpture, which represents the Titan, which we all know, and that holds on his shoulders the universe. And through that symbol, we talk about our technology and our advancement in space technology, and also, as a matter of fact, in underwater technology, because the universe has those two blues, let's say. One of them is underwater, and today underwater exploration is really the forefront of Italian research and technology. But on the left and the right, we went in a little bit more in depth, and especially on the left side of our visitor experience, when you come in, we talk of the individual, the person. And so it's the me, I suppose, part of our visitor experience. And so the whole sector of life sciences, of life in the future, how do we address aspects that we share with Japan, as the case of aging population, which we like to call longevity, because it sounds nicer. But as a matter of fact, it is one of the challenges that we have to address. And this expo is all about society. It's about designing future society for our lives. And the reason why the first thing that you meet is this theme is also thanks to Assolombarda. So I'm very happy to welcome today the president of Assolombarda, Alessandro Spada. We signed an agreement together many months ago, which in fact started this cooperation that brings us to this event today, and that will bring us in June, on the 24th of June, to another very important event, Agevity, which we will organize here together with Assolombarda and the Silver Economy Network. So we really value the presence of President Spada. We value the presence of Paolo Fiorino, which is the Chief of Division of Endocrinology at Fate Bene Fratelli in Milan, Paola Vella, who is the counselor of the Lombardia cluster of life sciences. And we are very happy to have with us Ako Makiyama, who is Executive Director of the Chamber of Commerce and Industry of Osaka, which is, I have to say, a very precious partner for us, and will accompany us in many events during this semester. Nagatomo Hamahata, Head of Oncology Alliance Management of Daiichi Sankyo. Kansai is a very important, I mean, I'm saying this for our Italian friends. The area of life sciences and pharmaceuticals is very strong in this region. So we really, this is a great opportunity to have an Osaka Banpaku here and to have a pavilion here which will serve as a platform for many of our industries. And this is something that is very important for us, and brings me to say also to welcome Giampaolo Bruno, who is the director of our Italian trade agency, which is our partner. We have signed many agreements together, many times, as a matter of fact. And so we are partners together, and this is a platform which also allows us to talk about our culture, to talk about our research, to talk about areas as we are discussing today, but also to talk about our high tech and our culture, of course, which go together on the pages of Leonardo da Vinci, which are just behind this wall. So thank you very much for joining us today. Hello to all also outside our pavilion, and I hope this will be really a great opportunity to also talk about a subject which we have given such importance to in our pavilion. Thank you very much.
Thank you very much. Thank you very much, Commissioner General for Italy at Expo Osaka 2025, Dr. Mario Vattani. And sorry for the mistake before. And thank you again for hosting us. And please, I would ask our President, Assolombarda President Alessandro Spada, to join us at the podium.
Good morning everyone, and thank you for being here today. And it's a pleasure for me. And let me begin with a greeting to Mario Vattani, that is the General Commissioner of the Expo Zaka 2025, and Giampaolo Bruno, that is the Director of Trade Agency here in Tokyo, will speak after the end of this morning. It's a great honor. I remember when we met first time and talking about the possibility of being here and speak about this team. It was almost, I think, a year ago. And after that, we have been working a lot to make this happen. And so it's for me, it's a great honor, and to speak at this special moment today. As has been said before, is the first event that will accompany us through Expo 2025. From now to end of October, we will organize this event in partnership between Assolombarda, the Italian pavilion, and the Lombardy Life Science Cluster. Expo Osaka 2025 is built around a powerful and minimum theme, that is designing future society for our lives. So it's a global event that put life, the future of the humanity, and share the responsibility between a nation and its core. And what a better chance and occasion to celebrate and improve the strong cooperation between Italy, represented here by the dynamic territories of Assolombarda, and Japan, especially on the two key topics that make us together, that are health and longevity. Even though our countries are part of geographically different, Italy and Japan share something that is very special, are both among the longest living society in the world, has been already said. In Italy, almost 1 of 4 people is over 65 years old. And we expect that by 2080, the number will grow more and more, and this one should be 1 on each 3 people. If we look at the people aged 85 and older, they are now about 4% of the population, but by the 2080, we expect to be over 80%. So the number will grow from 2.3 million to 3.9 million. In Japan, these changes have been already happened, and more than 1 in 10 people is now 80 or older, and almost one third of the population over 65 years old, which means these people are more than 36 million in total. So it's a little bit less than one third. This number are a matter of fact, and they push us to think in 2 directions. On one end, how our society are changing and how we must respond to these needs. And the second point is how to address the general issue of demographic decline, which touch both of our countries. In a world that is aging fast, this shared reality can become a strategic alliance. Italy and Japan can bring together their strength and know-how and work on a new shared project and innovation. Japan has led the way in aging care and assistive technology. Italy offers a strong public health system and a unique partnership between excellence in private and public sector. We are also bringing serious scientific research and the people-first approach to care. But there is so much we can reach together. Expo, as been already said, is more than just a showcase. It's a place to experiment, to connect, and to imagine the future. We can collaborate and share challenges like prevent medicine, digital health, robotics, and the new welfare and care models, but also on healthy diets, mental well-being, and social inclusion. And in this journey, our company play a key role. Our company, together with the Japanese ones, can be the engine of innovation and real practical cooperation. They can be in value chain that combine technology and sustainability. Our goal is to connect the innovation and research ecosystem of Italy and Japan and drive forward solutions that improve people's lives. Longevity is not just about living longer. It is about living better. And this topic in Italy and Japan have a lot of offer to teach to all the other countries around the world. Our concept, that is the art of life, that also is the title of the Italian pavilion here in Expos, is more than a motto. Is a call for a future that's more human and more balanced and more people informed. This one, our needs and our request. Starting from today and through all the Expo Osaka 2025, we committed to building bridge between Italy and Japan in 4 key areas. The first one is the research and collaboration in the life science supply chain. The second one is to develop technology for living and aging. The third is the new model of care and preventing governance and prevention governance. And the last one is studying the impact of the environmental on longevity and vice versa. I wish everyone a rich experience, full of meetings, ideas, and partnership, because we need to do this to improve and to reach our goal. I hope that, as I said before, this one it will be a new chapter between a collaboration about Italy and Japan, based on health, entrepreneurship, and beauty of a life well lived. This one is our goal, and our goal that we want to reach with all of you. So I thank you, and I wish you all the best, not only for the other 2 appointments that we'll have later in June, but also for the exposition that is always an important part. Milan Solombarda, since the Expo of 2015 that we had in Milan, we believe a lot in this exhibition, because it brought a lot to our country, to our city. Milan became a city that now is known all over the world, and the beginning of everything was starting with Expo. And I remember when we put the candidation, that it was a long time ago, because it was, don't remember if it was 2008 or 2009. And most of the people, when we decided to make this candidation, they were surprised, because nobody knows about Expo. Now, we are pleased that after so many years, everybody knows about the global exhibition, and I'm sure that we'll have a lot of tourists and a lot of people that are from Italy. They will come here to visit our pavilion, and in general, all the Expo Osaka 2025. Thank you, and have a good day to everyone.
Thank you, President Spada, for your introduction, and you touched the 4 topics which are central in the project Assolombarda, which is the most important Italian company trade association is working on, is promoting since 2023, and also thanks to Commissioner Vattani, who supported the second edition of this project, which is called Agevity, which is synthesis of aging and longevity concepts together. We decided last year to launch inside of this project four streams of work. One, as you mentioned, is research collaboration. Research is basic and is, at the core of the progress for our lives and our technological advancement in all the industries, all the sectors, but of course also for healthcare and a good life. And there's a technology for aging, which is central for having better living elderlies in our societies. There's a topic of environment, which actually will be first opened this year at Expo Osaka, because it's something I think our countries, both of our countries, could work together. And we started looking for companies which are doing great stuff and great things on environmental change and sustainability here in Japan. There's a lot of competence, and so it would be very interesting to understand what's happening here. And then there's the prevention and care governance, prevention and care models. Well, in these terms, there's different approaches in all the countries. But one thing we were sure last year, given all the works and the speeches we had during our forum Longevity in September, is that prevention is the key to longevity. So if you work on prevention from the early stages of your life to the last stages of your life, it's most likely that you will be able to live a good life. So this is something we think we must work on in terms of culture, so together with our population. And this is a topic also governments needs to address. And during the ministry, Italian Ministry of Health Works this year, our minister also said that we will be addressing this topic and increase the budget for prevention, actually. Yesterday we were at the Osaka Medical School, and we heard about these very interesting policies in Japan, where all the people 40 years older until 75, if I remember well, need to be screened every year. And this is a very good practice for prevention. And why this is central? This is central also because, as the European Commission says, we will need to increase the productivity of our population. We will need to work more years, and so we will need to be healthier during all the stages of our life. And of course, when we think about longevity, healthy well-being, we also need to think about the impacts of chronic conditions, which can be prevented, of course. So if you work on prevention and if you work on cure advancements through life science research, you can try to reduce the burden of chronic conditions. Actually, in Italy, just to give you a figure, 70% of the healthcare budget goes to the treatment and the management of chronic conditions. And this budget would explode if we don't work on prevention. And so one of the main topics of last year event, and of course one of the topics of this year event, will be prevention advancements in terms of culture, but also research. And one of the topics inside of the prevention was the innovation in metabolic diseases, and especially on diabetes type 1, which is very different compared to diabetes type 2, also in terms of the stages when it happens during your life. It mostly affects the younger population and then continues through the year. But I would give I would leave the floor to our Professor Paolo Fiorina to give you more details. And so I take a chance to present one of the most important scientists working on this topic in Italy, which was one of the advisors of last year's event. It's Professor Paolo Fiorina, Chief of Endocrinology Division at ISST Sacco Fate Bene Fratelli, an Italian hospital based in Milan, and Professor of Endocrinology at the University of Studies of Milano. Please, Professor, join us.
Thank you so much for the nice introduction, and I really want to thank the Presidente of Assolombarda Spada and the Commissioner Vattani for having me here. It's an honor. And I also enjoyed yesterday the visit to the Osaka University, very nice experience. So if we think about longevity, diabetes for sure is one of the major killers, is one of the disease reducing our ability to live a healthy life in the long term. Today we'll talk about type 1, and I will show you the science we are doing in Milano area, a new therapy that we are generating in Milano for type 1 diabetes. So type 1 diabetes is a serious disease affected around 10 million of people in the world. 4.1 million would be alive today if diabetes will not be there. And overall, a person with diabetes lost 34 years of healthy life. This is in the world. On the left side, on the right side, you see the number for Italy. We have almost 200,000 people with type 1, 75,000 people who should be alive today, and 35 years life lost. There is an excess mortality if you have type 1 diabetes. You should consider that you become, normally the onset of type 1 diabetes is around 10, 12 years of age. And you can see here the lifespan in red in people with type 1 diabetes, as in green you will see the control. This is the mortality rate, actually, the opposite. So people with type 1 diabetes lost, you will see, 8 to 12 years of life. And this is the natural history of type 1 diabetes. So you started when you're very, very young, and you have some genetic factors, environmental factor, predisposing to type 1 diabetes. Then you have something which could be viral, could be bacterial, could be something else, inducing an activation of the immune system. And then slowly you end up being hyperglycemic after some year of oscillating hyperglycemia. We call it dysglycemia. So you go to a party, you have an increase in glycemia, then you get normal, and and then suddenly people went to the emergency department because the glycemia is very, very high. So at the moment, the only cure that we have available is the substitution for the lack of insulin. People with diabetes, particularly type 1 diabetes, lack of insulin. In type 2, you have mainly a malfunction of insulin, although in the late stage of type 2 diabetes, you have a lack of insulin as well. So there have been some attempt to try in the world some approaches. You see people with type 1 diabetes have been treated with OKT3, Daxoside, ATG. These are different names for experimental procedure. But if you look at the people cured, the number of people cured, you have 0, 0, 0, 0, 0, 0, 0, 0, 0, 0, 0. So it was a big failure. I mean, we failed in the past. And I'm going to show you a few new strategies that we are developing in the Milano area that we hope will be successful or will help to improve the whole thing. I'm going to start showing you, and I apologize for the scientific terms, but I'm a scientist. The first topic I want to describe is the discovery that we made, is that the glutamate transporter is expressed by pancreatic beta cell. It is overexpressed by people with type 1 diabetes, and when you overexpress this protein, you actually end up having an immune reaction against this protein. People with diabetes develop anti-GLT1 autoreactive T cells and anti-GLT1 autoantibodies. This was unknown until we published in 2022. And I'm going to show you a few data. GLT1 is overexpressed in the pancreas of people with type 1 diabetes. These are the level of mRNA in healthy control. This in type 1, you see an increase. People with type 1 have a lot of autoantibody in the blood, meaning they have antibody that destroy or attack this protein. So what we did with my team, I cloned the extracellular domain of GLT1 peptide here. In particular, we cloned the extracellular epitope, which we believe are antigenic, meaning stimulating the immune response. And through in silico prediction and solubility test, we came out with six candidates, which you can see here. These are 6 proteins, which we use to create therapeutic tools. And just to show you, this is the immune response against the peptide that we created. There is actually a strong immune response in people with type 1, meaning that if you have type 1 diabetes, you recognize this protein, you react against this protein. What we did next, we actually create a binding between our protein and some monomers, MHC, MHC2, and then we loaded with some color fluoromer, which we call it dextramer. And we are able now, as you can see here, this is a flow cytometry. I apologize for the not scientist, but I'll try to explain. Basically, we created some protein, color. We can actually bind to T cells which recognize the protein. So we can track, we can recognize, we can analyze, we can select this cell. These are the cell, the bad T cells which attack the beta cell. And what we can do, we can actually load into this dextramer small molecules or whatever you want to destroy those autoreactive T cells. So this is the first things we are doing with the idea of destroying autoreactive T cells that can attack the body. Let me show you the second strategy. So we have, and these are the publications we made. These are the publications we made in the field. You can see, you can appreciate the quality. ATP is basically the fuel of cells, but when a cell is suffering, ATP is released into the body as extracellular ATP. Extracellular ATP binds P2X7, which is the receptor for extracellular ATP. So what we did, again, we create a fake decoy by cloning the extracellular receptor, P2X7 here, and we injected this fake extracellular receptor into the body of animal, and actually these can bind the extracellular ATPs released by the cells. So what we can do, we can actually distract extracellular ATP from being released into the body and inducing inflammation. And when we treat animal with our compound, we can prevent rejection. You can see here, these are animal treated. These are animal treated, untreated. They reject the islet. They have diabetes. But with our compound, we can actually delay the onset of rejection and prevent the preservation of beta cell. I have a small video to show you what I just described here. This is the pancreas. These are beta cells producing insulin, and when there is an inflammation, you have a release of extracellular ATP here. This is extracellular ATP. Extracellular ATP binds to T cells, to T lymphocyte. Here, you see. This is P2X7 activating the T cells. So you have a lot of inflammation, a lot of damage induced by these T cells, inflamed. The T cells get into the pancreas and they induce beta cell death. We created this unique molecule, which is a decoy, which you can inject, and actually binds to extracellular ATP, preventing the binding with the original receptor, with the endogenous receptor. So the T cells are not activated, and they're happy in the circulating blood, not attacked in the pancreas. What else? We also generated some nanotechnologies. Particularly, we were able to encapsulate anti-CD3, which is an anti-lymphocyte antibody, into nanoparticles. And why we did that? Because nanoparticles can be delivered to very unique niche. Actually, you can use nanoparticles and deliver them, for instance, into the high endothelial venous. High endothelial venous are enriched in the area where there is inflammation, in the pancreas, in the heart, also where there is tumors. People are using nanoparticles to deliver chemotherapies to a high endothelial venous. We did something else. We put into nanoparticles cytotoxic compound, cytotoxic for T cells, with the idea of delivering them into the pancreas, into the pancreatic lymph nodes, and prevent the immune attack. So this is our technique. We took the anti-CD3, we encapsulated into these particles, into nanoparticles, and then we inject them. They go to the pancreas, and they prevent the activation of the immune system. These are animal treated with our compound. You see normoglycemia. This is the blood glucose. When it's high, you have diabetes. When it's low, you have no diabetes. With the nanoparticles, you can actually reduce the glycemia. You can actually prevent the inflammation. But when you don't inject, you have high glucose level. And as you can see here, this is the level of inflammation into the pancreas. With our nanoparticles, which arrive to the pancreas, you have very low inflammation as compared to the animal treated or actually untreated with nothing. I'm going to show you a couple of more stuff. And this one I'm very proud. You're all familiar with the PD-1, PD-L1 pathway. The PD-1, PD-L1 pathway has been granted the Nobel Prize in 2018. And I was lucky, when I was working in Boston, I had the pleasure and the honor to work with some of the immunologist leader working in the field of PD-1, PD-L1. And so Mohamed Sieg, Larry Turka, Arlene Sharp, and Gordon Freeman. And we came out with the idea of working on doing something different. So most of the people basically block PD-1 to stimulate the immune system in cancer. We did the opposite. We are actually stimulating the immune system with cells that are transgenic for PD-1, in which we overexpress PD-L1. We discovered in diabetes there is a deficiency in PD-L1, and we created this immunostem. What are immunostem? Are hematopoietic stem cells in which we overexpress PD-L1. We took those cells and we charged with genetic engineering a lot of PD-L1. So these cells are circulating in the blood, and they are waiting to see T cells and to block them. So our immunostem, or PD-L1 transgenic cell, have strong immunoregulatory properties. They suppress autoreactive T cells, and they prevent the progression of diabetes. This is the original paper. This is the way we produce immunostem. We basically took stem cell. In mice, they are called KL. In human are CD34 cells. We perform lentiviral transduction. We created PD-L1 transduced cells. And then, with the use of an inducer, we can actually upregulate PD-L1 whenever we want. So, by injecting doxycycline in mice or in human, wherever, we can upregulate PD-L1 exactly when we want. And in animal treated with immunostem, the pancreas, these are pathology, histology of the pancreas. The pancreas is clean, there is no infiltration. And again, the glycemia is much better than in animal treated. You should consider that in animal untreated, glycemia is like here, very, very high. In animal treated, you have glycemia falling in the range of normoglycemia. The gray area here is the area of normoglycemia. So most of the animals become normoglycemic. And again, I have another video to summarize what we did here. Oops. Doesn't work. See? Doesn't work? Okay. Anyway. Or maybe slow? Anyway. Okay, fine. So in this video, I was basically summarizing again. Or maybe it's moving. Let's see. Okay, here. We're always talking about the pancreas, of course.
The pancreatic beta
No.
cells, which produce insulin, are attacked and destroyed in type 1 diabetes.
Okay, yes. Yeah. No, I think there is a mistake in the video.
Autoreactive T
see?
lymphocytes are responsible for beta cell destruction in type 1 diabetes.
Okay,
The
yes.
human bone marrow contains a large amount of cells, including the hematopoietic stem and progenitor cells.
So you have hematopoietic stem cell in the bone marrow. So we extract them. They are deficient by PD-L1 in type 1 diabetes. As you can see here, they're circulating with a very low level of PD-L1. And by pharmacological modulation or by genetic engineering, we modify hematopoietic stem cell by overexpressing PD-L1. And they are super strong immunoregulatory cells, which basically block T cells from being activated. They also traffic to the pancreas because they have a natural GPS during the upregulation of PD-L1. They traffic to the pancreas. And they basically block the attack of T cells to beta cells. And I'm going to show you the last strategy that we have. This is in clinic. I'm happy to report that this strategy actually we just finished the phase 1 trial in healthy volunteer, and we are on the way of finalizing the phase 1b, which is the trial in patients. So I discovered this receptor, TMEM219, which is a DEF receptor expressed by pancreatic beta cells. The receptor recognizes a protein that we have in the blood, which is called IGF-BP3, and whenever they bind, they activated a apoptotic signal, a death signal into beta cell. In diabetes and in type 1, there is a dysregulation of the axis, being IGF-BP3 overproduced in the blood. And we discover that the genetic deletion of the receptor or the pharmacological blockade of the receptor is capable of delaying the onset of type 1 diabetes. I'm going to show you just a few data. The receptor is an amazing receptor which we discover being expressed on the surface of beta cell, is also expressed in human fetal pancreas. So you should remember, during the fetal life, we need to have a lot of proliferation of organs, but you don't need the same proliferation where you are an adult. So this receptor is expressed in a fetal life when there is a lot of rearrangement. You have proliferation and tissue death, but in adult life, you don't need it anymore. When it's dysregulated, you have disease. So what we did, we deleted TMEM in mice. We created a unique mice, which is the beta TMEM knockout mice, in which we can knock out the receptor only in the pancreas, and we also created anti-TMEM 219 antibody. When you provide these two treatments in animal, you actually create an amazing super pancreas, super endocrine islet. This is an islet, you can see here. Normally, you should expect like that size, small. When you block the receptor, your pancreatic beta cell proliferate. They become super big. They produce insulin at a very high level. You see here, very high production of insulin. So, to close my talk, I believe that diabetes research in Italy has made amazing progress in the recent years. Italian researchers, as the Japanese counterpart, have contributed to the treatment of type 1 and type 2. And we are focusing really on innovative technology. Of course, investment in research is fundamental. And we are lucky because in Milano, we recently created two startups. One is Enthera, which has been joined by AbbVie and Roche. And the other one is Altea, more recently created. They both collected a good amount of money, which will allow them to get into the clinic with some of the strategy that I just presented. And I want to finish to thank my team. These are some of the young people working with me in Milano, try to find a cure for type 1 diabetes. Thank you so much for the invitation.
Thank you. Thank you very much, Professor, for this very interesting talk. And we know this is a very great challenge for Italy and also for Japan. In Italy, maybe the numbers are higher. We have 300,000 people living with diabetes type 1. And I guess the different approaches you showed are part of this process of personalizing and making medicine always more precise. So I think this kind of approach would be the future approaches for medicine. And thank you very much for presenting this to us. And we hope this could be just the start for cooperations between probably the Osaka University and also the hospital and the University of Milano. Thank you. So we started with let's say, an overview on a very specific theme and topic, which is metabolic diseases and diabetes type 1. When we normally talk about longevity and we talk about healthcare and the causes of death, normally we think about also other areas which are very impactful. There's cardiovascular diseases, there's oncology nowadays, there's respiratory diseases, and here both bacteria and viruses play a very huge role. Let's say the link between all of this, of course, again, it's prevention, but it's also research. But getting back to our aim, our objectives, as we are stressing a lot, is generating knowledge among our countries, getting to know what we are doing, what we represent as a Lombardy region, as Italians, and what you represent as Osaka region and Japan. And for this reason, we wanted to launch this second session where we would start describing what does it mean life sciences for our countries. And we will have together with us Paola Vella, which is counselor of the cluster Lombardo Scienze della Vita, so the Lombardy Life Science Cluster. Welcome. Which is, I have the honor also to direct since 1 year and a half and work with Paola. Then we will have with us Ako Makiyama, which is Executive Director of Osaka Chamber of Commerce and Industry, which will talk about life sciences. So please, Ako, welcome and thank you for being here and join us. And last but not least, we will have also a contribution for one of the partners actually of the event last year, which is a contribution from Daiichi Sankyo. And so Mr. Nagamoto Amahata, Head of Oncology Alliance Management at Daiichi Sankyo, please welcome on the floor and join us. So if you want, you can also use your radio for simultaneous translation. And so let's talk about Italy. And I mean, I'm really pleased to have the Lombardy Life Sciences Cluster as a supporting entity of this event. There's also the national cluster, Alisei, from Italy. There's the Italian Trade Agency, the Embassy of Italy in Tokyo. But of course, and thank you very much to the Chamber of Commerce, to the Osaka Prefecture that we met in the United States, and now we are here collaborating. It's really a pleasure, and Osaka Bio headquarters. So talking about life sciences, Paolo, which is of course your topic, and I mean you have a scientific background, but then you dedicated to developing the life sciences ecosystem. I would leave you the first presentation to show to our speakers and our attendees from Japan what does it mean to work on life sciences in Lombardy, what does the cluster Lombardo Scienze della Vita does, and what your organization does, because Paola belongs to a very important institution in Italy, which is Humanitas Research Hospital, which was also announced as the first and most performing hospital in Italy. So thank you, Paola, and please, you can start your presentation. You have your pointed there. Prova, aspetta.
No.
Vediamo se-
No, yes. I can repeat. Konnichiwa, buongiorno a tutti. It's a pleasure today to be here. And firstly, I wanted to express my sincere gratitude to President Spada and also the General Commissioner Battani to be invited today to represent Italy, to represent Lombardy, and to explain how Lombardy and life science and health system is crucially and really innovative in Italy. Thank you, Felice, for introducing me. And very briefly, as you already said, I'm a member of the board of the Lombardy Cluster Life Science, and I'm also the Director of Technology Transfer Office at Humanitas Research Hospital. It's a private hospital recognized by the Italian Ministry of Health as a center of excellence, and is the first hospital in Italy. And today I would like with you to have a very showcase about the strength of our cluster, about the special focus of Lombardy in upcoming business and to foster the partnership with Japan, and also the groundbreaking research for clinical and preclinical activities in Humanitas. Let me start with the first slide, and this is a very quick overview of Lombardy. As you can see, is a dynamic region in the earth of Europe, sorry, with a population of over 10 million and a significant GDP. This briefly mentioned that the area, population, and the GDP per capita to establish the region as the core region in Italy for the economic impact. And what also I would like to say, and sorry, to capture your attention, that the life science ecosystem in Lombardy is 1/3 of the total number of the Italy, particularly in pharma, in research and university that are represented and present in Lombardy as well. And what is the cluster? The cluster is not only a group of entities, but is a community strongly dedicated to life science in Lombardy region. What we are trying to do is to bring together all public and private entities from research in industry and clinics with the mission to try to foster the public-private collaboration, with the vision to increase the Lombardy as not only the crucial part as a European region, but as a global partner. How we do this is make ourselves available with the entity engaged in generating innovation, in fostering collaboration, but also to try to make new policies and also new innovative approach for health and also clinics. The organization sectors is very briefly in the snapshot divided as a percentage, with the 27% are in health and wellness, the 23% in medical devices, the 18% is most biotechnologies, the 18% is digital health, and the 13% is pharmaceuticals. These numbers also can remember what President Spada said before in the open welcome that they did. And it's crucial for us to be here today, and this is the most logo of the members of the Lombardy cluster. During the last 2 years, we really do hard work with the cluster and also with the support of the member like Felice and Assolombarda to prioritize the action lines and also the areas of interest, because the clinical research and the activities of technology transfer is a part of a broad picture in which we are trying to interconnect all of the actors of the cluster to support them also for biobanking, digital health, and international promotion, in order to have a value chain that is a really valuable value chain for having the same policy and also simplify the bureaucracy for attracting pharmaceutical company and also for the international perspective. We believe in the power of global collaboration, and during the last 2 years, and today is an example of this big effort of cluster of Lombardy Life Science and Assolombarda to be present in the most important event globally attending, like in Boston, in San Diego for International Convention, also to CPHI for manufacturing, and the last bullet in the map is obviously, and we are very pleased to this Expo 2025 in Osaka. I would like also to remember what President Vattani and also President Spada already to refresh the next step on our mission is the event and the entrepreneurial mission in June, in which we would like to have the second step of this participation to foster the partnership with you. I'm very also pleased also to give you a brief overview about Humanitas and to give you the perspective. I think that the video can show better than the number what Humanitas is. Thank you. I will go very fast because you already said the number, but as I previously said, I represent the flagship hospital of the Humanitas Group that is located near to Milan, precisely in Rozzano. We are the flagship hospital because at the same place, and the video show the Humanitas ecosystem, at the same place coexist the healthcare, the education and the research. At that time, the slide is not updated because we recently acquired a new hospital in Sicily, in the southern of Italy, and now the hospital is 11 with a lot of patients and also inpatients that come across for other regions of Italy, but also for outside European and also global patients. Humanitas Research Center is also highly specialized in research and the university hospital. This is the number of the clinical trial that carried out in 2023. More or less is 50-50 split between the for-profit and spontaneous clinical trials. The other number represent the research numbers of scientists. 500 people are involved in research. Of these, 100 are physicians, like Professor Fiorina, that is with the same background, like Professor Fiorina, that are physicians at the same place, also scientists that are trying to carry it out and to really have the closed by the bed of the patients with the bench. And what we do is to try to be innovator in unmet clinical needs and to advance the mission to treating the patients with cutting-edge technologies and also cutting-edge therapies. Last year, we tried to foster this type of connection internally at Humanitas, creating the 5 translational research projects in oncology, gastroenterology, neuroscience, immunology, and cardiology. This means that we at Humanitas cover mostly broad of the disease, like obviously the oncology and immunogastroenterology like IBD, but also cardiology and metabolic disorders and neuroscience. For doing that, Humanitas, as I said before, is a private hospital with very good revenues in Italy, is not only the first for the clinical treatment, but also for the economic sustainability of the Humanitas Group. This means that every year Humanitas reinvests a lot of money internally to be and remain upcoming and in the innovation. And for doing that, we recently opened the 3D Innovation Lab that is located in a new building, the Innovation Building that hosts the MedTech course. Is the only one in Italy that gives the possibility to students to become at the same place the physician and also the bioengineering. And how we can support the scientists and also the clinicians with the platform, with also platform for clinical trials, with Biobank and with AI Center. This is some very few numbers about me. I take the responsibility of Technology Transfer Office in 2021, and the top management give me a very big challenge to try to change the Humanitas perspective, also in terms of patents, in terms of industrial collaboration, in terms of the value creation about licensing and spin out. And I'm very proud to this number because we are very young in this new perspective. this new perspective on technology transfer. And during these last 3 years, 25 patent families are managed, and we strongly believed in the integration between research laboratories and clinical departments. A lot of NDAs and being signed with the pharma and biotech companies. 100 pharma and biotech companies venture capital has been reached out during the global international events. At the time for licensing is active, one option evaluation agreement, and 4 spin-off. Some of these has been already established, other is undergoing construction. As I said before, we're partnering with us for the high concentration of outstanding scientists and clinicians, for the strong interaction between the scientific excellence, also to the privileged access to the advanced technology platform. I would like to thank you for your attention and to give you my really message that I think that the future of life science is collaborative. The Lombardy Life Science Cluster is trying to do in this, and Humanitas is part of this big picture, and the Lombardy Cluster is the forefront for this movement, and please reach out. We will be very proud and pleased to foster the collaboration with Japan. Thank you again for your attention.
Grazie. Thank you, Paola, for your presentation and for presenting also the potentials and possibilities of cooperation and what you already achieved as performances as a technology transfer office in Humanitas. We will pass from a region which represents 50% of clinical trials in Italy to another very important regions that represents the most of life sciences for Japan. And we will do this with Misako Makiyama. Thank you again for being here. She will speak in Japanese, so please switch your radios on the language you prefer, and which will present the life sciences ecosystem here. And again, she is the executive director of the Osaka Chamber of Commerce and Industry. Thank you very much, and thank you very much for participating to the event and sponsoring it.
Thank you very much for introducing me. Thanks so much. I'm very honored to be here and speak on behalf of the Osaka Chamber of Commerce and Industry. Thank you very much for your time. And actually, I have an opportunity to visit the Milano Expo 10 years ago.
In 2015, yeah.
Yes. で2015年のミラノ万博に大きなデリゲーションをと一緒に参りました。この時のテーマはデザインの力。イタリアがすごく強みのあるデザインの力がいかにソフィスティケイティッドなライフサイエンススタイルを実現しているかというところのスタディというところでありました。ミラノ工科大学でありますとかプライベートレジデンスにもお邪魔をさせていただいたり、大きなインテリアのエグゼビションも拝見したりとかいうところ、アペリティーボをブレラエリアで楽しんだりとか、みんなでライフスタイルイタリアの方々の勉強したというところで非常にインフォーマティブなツアーになったというところです。ライフスタイルが非常にウェルビーイングに大事だというところを実感したところなんですが、本日10年後にロンジェビティというテーマでこのライフスタイルとかウェルビーイングについてもう一度スピークさせていただくということは非常に感慨深い経験になっているというところです。これもご覧いただくと皆様方ご存知の通り日本もイタリアもトップランキングにある長寿の国であるということは示されているところです。日本は 84.3 歳アベレージ長寿ですよね。イタリアも83歳非常に長寿の国でこれは非常にいいシチュエーションだと思いますけれども、問題は 健康寿命との間が10年あるというところです。右側の表は、健康な年齢、健康でいられる年齢が右の表です。ご覧いただくと、イタリアも日本も10年の差があると。つまり、人生の最後の10年は、何かイルネスとか、ディサビリティでサファリングしているという時間が10年もあるというところは、これはインディビジュアルウェルビーイングにも非常に良くないですし、エコノミックグロースにも良くないですし、とても大きな社会的な問題だというふうに考えているところです。一方で、メディカルテクノロジーというのは非常に進んでいるというところで、大阪・関西もこの、ワールドクラスのライフサイエンス、ヘルスケアの、アキュミュレーションがあるというふうに言えるというふうに考えています。グローバル、レベルの、京都大学、大阪大学のようなユニバーシティもあれば、ファーマスティカルカンパニーもたくさんあるというところ、新しいテクノロジー、イノベーションはたくさん進んでいるというところは言えるというところだと思っています。例えばですけれども、iPS の研究、ノーベル賞受賞研究ですけれども、もう皆さんご承知の通り、心筋シートで、心臓の疾患に対しての、トリートメントを行うでありますとか、加齢黄斑変性といった、目の病気のところに対して、角膜の再生医療を行う、こういったところ、それからパーキンソンディジーズについても、臨床治験が行われているといったところで、こういった研究、基礎研究がかなり臨床レベルに届いているというものが多くなっているというところで、新しいメディカルケアというところが関西から生まれているということがいると思います。本日は第一三共さんいらっしゃいますけれども、大阪にもたくさんのファーマスーティカルカンパニーがあります。すごく画期的な作用基準で、がんを、トリートメントするドラッグでありますとか、塩野義というような製薬企業はインフェクションディジーズにとてもフォーカスをされている。COVID-19 は非常に大きな影響がありましたけれども、これからも、おそらく感染症は、世界的な脅威、また起こることがあるだろうというところがありますので、大阪の製薬企業もグローバルヘルスに非常に貢献をされている企業が多いということは言えるというふうに思います。一方で大阪商工会議所、我々の商工、オーガニゼーションなんですけれども、もうすでに25年以上ライフサイエンス、ヘルスケアビジネスについての、コミットをしてきているところがあります。これをご覧いただきますと、ドラッグディスカバリー、それからメディカルデバイスデベロップメント、ヘルスケアというところから、スポーツウェルネスまで非常に広い範囲で健康医療の、ビジネスをプロモーションしているというところが我々の特徴。それから大阪・関西だけではなくて、全国の250ぐらいのユニバーシティとか、リサーチインスティテューション、それからメディカルインスティテューションとネットワークがありまして、カンパニーも、東京ベースのカンパニーも多く、我々のアクティビティに参加して5000社以上の参加があるといったようなかなり、ネーションワイドな、取り組みを行っている特徴があります。これ少し、意外な、データかなと思いましてご紹介をしたいんですけれども、日本人は結構ヘルシーな、行動をとっていると思われている方多いんじゃないかなと思うんですね。で、健康な人多い、健康な行動をとっていると思われがちなんですが、実は23カ国のうち最下位っていうデータがあります。グッドスリープ、それからグッドニュートリション、それからエクササイズ、特にそのプリベンティングディジーズにとって大事なところの要素、そういったところに対する関心が低くて、積極的にそういった分野での行動を取っていないというデータがはっきりと出ていまして、日本人は、病気疾病予防をするといったところの観念、自分自身で、健康を維持するというところの、感覚が非常に低いっていうデータが出ているところがあります。もちろんこれはとてもいい保健医療があって、それから、いつもアクセス病院にできると、いい医療にアクセスできるというところがあるということがありますが、あまり良くない傾向というところがあります。これからの社会の中でロンジビリティ考えると、やはりプリベンティングイルネスは非常に大事というところですので、これは日本にとっては非常に大きな問題というふうに考えています。そこで大阪商工会議所が思いましたのは、日常生活にいかにウェルネス、ヘルスケアサービスとかヘルスケ ケアプロダクトを導入していって使いやすくするのか、無理せずに日常生活の延長線上で使えるかといったことを進めるプロジェクトが大事だなというふうに考えたところです。これをウェルネスオフィスプロジェクトという言い方をしているんですが、オフィスであったり、家、自宅であったり、パブリックな、スペースであったり、そういったところに、ヘルスケアがすごく身近にあるという、形を取るプロジェクトが進められたらというふうに思っているというところです。こういったところで、パブリックなスペース、それから人が集まるところとそういったプロダクトをマッチングするような事業なども行っています。これは一つの例なんですけれども、どういうことを言っているかということを具体的に示したいんですが、左の方の写真は塩野義製薬のリサーチセンターなんですが、このとてもとても洗練されていてカンフォタブルなスペースになっているんですが、リサーチセンターの中を歩く移動が多い、それから階段を上る移動が多い、それで、研究者同士コミュニケーションを取るという構造にスペース自体がデザインされています。したがって研究所にいて、いろんな研究をして、コミュニケーションを取っている中で、自然とエクササイズができるという設計になっているというところで、健康を考えられたスペースデザインということがあります。右側は、JR 西日本、関西の中で一番大きな、鉄道会社というところになりますが、ここが、ヘルスケアの計測、健康計測を簡単にできるポッドというもの、こういった箱型のものですね、これを開発して大阪駅を含めて主要な駅にこういった、センシングできるポッドをすでに置いておられます。なので通勤の途中とかお家に帰る途中に、簡単に自分の健康計測ができるというところで、こういったことを、簡単に日常生活の途中でヘルスケアの活動ができるということが日本人にはすごく大事になっているということがあります。でこういった、ウェルネスオフィスプロジェクトを進めようとすると、おのずとデジタルヘルスプロダクトのデベロップメントは非常に大事になりますので、大阪商工会議所は、そういったプロダクト、デジタルヘルスプロダクトをデベロップしているスタートアップの、大阪ヘルスケアパビリオンでの、展示のサポートをしております。来週火曜日から2週間、26社のスタートアップが面白い、製品を紹介いたします。左側の例、なんですけれども、これはスマホにつけるデバイスを開発されていて、これによって遠隔で目の、診療ができるものです。例えば、眼科医が非常に遠いところにしかいない場合、すでにアフリカとか南アフリカでアメリカで使われている事例があるんですけれども、遠隔で、眼科医がいても、目の診療ができるといったところ、こういったデバイスでありますとか、右側は、早期に、事前に心筋梗塞などの予兆が分かる、これもスマホとかで分かるようなものといったもので、こういったものの展示を行うようなものです。すごく低い塩分のものを取らなきゃいけないっていう高血圧の方々も、この、左側の方は、電気刺激で塩分を強く感じるようなデバイス、塩分は低いけども美味しく感じるようなデバイスでありますとか、ブレイン、ウェーブをセンサーすることで、自分に合った、ミュージックが流れるといったところで、リラックス効果があるようなデバイス、こういったものも展示しています。それからもう一つ、こういった形でいろんなプロダクトをデベロップできる、企業がたくさん大阪・関西にはあるんですが、大阪のポテンシャリティ、アドバンテージとしてもう一つの要素があります。これはスーパーシティという経済特区に指定されているということです。でこのスーパーシティでは規制緩和を、早く進めることができる特区になっています。でヘルスケアとかメディカル、テクノロジーのイノベーションのためにはディレギュレーションというのは非常に重要なことがよくありますので、早くディレギュレーションができる、そういう実証的な取り組みができるということは非常に都市としては大事というところで、大阪はそういうスーパーシティですので、早くディレギュレーションしてもらいますので、ここでの研究というのは非常に有効じゃないかな、エフェクティブではないかなというふうに考えます。 これは飛ばしまして、エコシステムで考えますと、私どもは、ドメスティックなエコシステムというのは当然あるんですけれども、例えばロンバルディアのエコシステムとつながることで、グローバルなエコシステムを完成させるということが大事というふうに思っています。ドメスティックなエコシステムアローンでは十分ではない、特にグローバルマーケットを目指すようなイノベーションというのは、2つのエコシステムがつながるといったことが非常に大事と思っていますので、具体的なコラボレーションのアクティビティをしながらエコシステム自体をつなげるっていうことができればというふうに思っています。最後のシートになりますけれども、ロンジェビティ、単純に長寿ということだけではダメだということは、もう今までの先生方のお話にもあった通りであります。我々も desirable longevity というところを目指すということをしたいというふうに思っています。例えばなんですけれども、80歳でも90歳でもハイヒールを履いて街を闊歩して、もうバイブラントな感じで、生活することができる。こういった街っていうのが desirable longevity を実現する社会だなというふうに思っています。そういうことができるというのは、フィジカルもメンタルも、それから認知機能も全てが健康でなければできないというところがあります。なので、そういった方々が多くいるという街がdesirable longevity を実現している社会だということが言えるというふうに思います。で、desirable longevity を実現するためには当然ながらイノベーション、リサーチ、それからテクノロジー、ニュービジネス、たくさんの要素があります。必要ですけれども、他にも必要なのがやっぱり、sophisticated なライフスタイルでありますとか、ヒストリカルな街づくりでありますとか、カルチャーでありますとか、街の総合力は非常に重要だというふうに思っています。ロンバルディとか大阪・関西はそういった意味で非常にアドバンテージがあるというふうに思います。テクノロジーもイノベーションもリサーチもたくさんあって、アドバンスドなメディカルもたくさんありますけれども、カルチャーもヒストリーも非常に面白いライフスタイルもたくさんあるということは、この Desirable Longevity を実現できるというふうに思います。2つの、地域のコラボレーションによって、これからの未来のDesirable Longevity の社会、どんなあり方がいいのかということを世界に提案することができればと思っているところです。以上であります。Thank you for attention. Thank you so much.
Thank you very much, Ms. Makiyama. Your presentation was really rich of concepts and topics, and I really see very much connections between the ecosystems, but taking some of your concepts, you talked about also the importance of startups working on well-being at the workplace. Actually, Assolombarda is launching a project also in this sense, so to work through a network, Italian network called Silver Economy Network, to involve companies and teach them how to make their environment better for workers. Healthcare in the workplace is very important everywhere, I guess, and companies can, corporates can have a big role in this. But you also talked about the last slide was also about the lifestyle, living a good life and being able to have a desirable longevity, desirable lifestyle also have a great impact on many diseases. The researchers found out if you live well, you can have less level of, mental health problems or pathologies and diseases connected to these conditions that can lead to chronic diseases because of people staying more at home and don't feel confident enough to go outside and live a life. And being able to move and being able to be part of the society is the main objective everyone and every organization must have for future societies. So thank you very much. And we really touched very specific but also broader concepts, and we saw how our regions are working on the concept of longevity through life sciences. But talking about life sciences, we talk about a very complex and enormous industry, a very enormous ecosystem as we consider it, because we have both the public and the private institutions, from research to industry, from research to life, as we say. And industry, and specifically today with the contribution of Mr. Nagamoto Amahata, we will have a chance to understand how a Japanese company, which is also a multinational company, also working in Italy, is addressing the aging population topic from the pharmaceutical point of view. Daiichi Sankyo is a company focusing on two very important areas, also in terms of demographic change and aging, from cardiovascular diseases, which are still the first cause of death worldwide, to oncology, where you are launching many also partnerships worldwide on this. So we're very pleased to have you here, and very pleased to give you the floor to let us know about your vision and what you're doing as Daiichi Sankyo. Thank you very much.
Thank you. Thank you for the introduction, and thank you for having me in this the great the occasion. And I'd like to provide you that some industry perspective, as you mentioned. I think the longevity is a wonderful thing, but there are some challenges. So that's what we are doing from the industry perspective. I'd like to explain a little bit, and then also that introduction of our company as well. And I'd like to start off with introduction of our company. We, the Daiichi Sankyo started from 1899, 126 years ago, and from the start, we have stood for scientific innovations, improving people's life. And when you look at the left-hand side, the Jokichi Takamine, he is one of the founders, discovered diastasis, and in 1899, at the time of foundation. And he also succeeded in the crystallization of adrenaline for the first time in the world. And then, another founder we have, below the Dr. Takamine, there is a Shozaemon Keimatsu. He succeeded in the domestic production of earth phenomenon in 1915. And since then, Daiichi Sankyo has developed the medicines in various therapeutic areas. And we have a long-standing commitment to cardiovascular area and provide innovative medicines for millions of people. And then now today, we have antibody drug conjugate that precisely target cancer cells and help people with cancer live longer and better. Another kind of the introduction of Daiichi Sankyo. So Daiichi Sankyo is a globally operating research-based company, and with 20,000, almost 20,000, the employees, all over the world. And our business footprint is, in 32 countries, of course, including Italy. We have 345 employees in Italy. Head office is in Rome, and oncology business in Milan. So that's our kind of current status. And we value Italy as an innovation-friendly market and with cutting-edge medicines and research. And then also we have grown and often adapted to the challenging, challenging environment. We still have the same goal to improve lives and health spans through our product. We want to push the boundaries in the fight against the leading causes of death and contribute to the sustainable development of society. And then this is also reflected in our, the company vision. So our 2030 vision is to become innovative global healthcare company and contributing to the sustainable development of society. Okay. Now I'd like to change a little bit topic to that longevity. So I'd like to move on to our case for the longevity with three thoughts on the left-hand side of this slide. When we discuss longevity, we tend to focus on the challenges that come with it. And I believe the great thing overweigh all challenges. And that's why my thought, number one, is there is a link between health, a long life, and the productivity of society. We can quickly take a look at what Italy and Japan have achieved in the past. In 1990, around the same time our company was established, the life expectancy was about around 40 years in Italy and Japan, kind of the worst in this table. And then today, both companies are leading the statistics. Right? Italy, they're having twice as long as that in 125 years ago, and the Japanese, even longer. So, if you look at the economic development, over this period, you find there is the chicken and egg, the relationship between the life expectancy and the prosperity. And during this time, both Japan and Italy established themselves in the top 10 wealthiest countries in the world. It turns out the healthy society is a wealthy society, and that goes both ways. It is kind of a self-reinforcing ecosystem. And good news is this trend continues. And according to the United Nations projections, it will take 4 more decades for Japan to be the first country where a newborn baby can look forward to the life of 90 years old, followed by Italian babies. So of course, that the correlation between the health and wealth is not Japanese and Italian specialty. All over the world, the healthy people participate more in life. They are more productive. They don't burden healthcare system, and they consume more. So this is also important to have sufficient resources to take care of those who really have to live with a serious disease. And Italy and Japan are positioned as the top healthy countries, but at the same time, both countries face challenges, of course, caused by the aging population. This slide shows a change in cause of death in Japan and Italy. And cancer and heart diseases are still growing issues to be overcome by both societies. It's not just about longevity, but about ensuring the additional years are as healthy as possible, as mentioned before. It's about healthy, active aging. The main driver for increasing lifespan and health span are genetics and lifestyles and environmental factors. So now, let me focus on the environmental factors in my second thought, that is the key role of innovation and society's willingness to implement it. So, pharmaceutical industry has a responsibility to drive scientific innovation in healthcare. And as you probably know, the effort for the innovation is enormous. No other industry invests more in the R&D, research and development. And many pharma companies invest up to 20% of our revenues, and it pays off for society. And in this context, Daiichi Sankyo has strong capabilities in the field of science and technology. It's our driving force for value creation and to the society with our talent, core technology, and corporate culture. And we have accumulated our experience and knowledge and technology through creation of innovative new medicines. And we are committed to continue it. And in recent years, the Daiichi Sankyo has added our research focus on the antibody drug conjugate in oncology area and several other modalities in different therapeutic areas. And in 2023, from April 2023 to March 2024, we invested 364 billion yen, which is roughly 2.3 billion euro in R&D, and which is about 23% of our annual revenue. So, and then we expect to launch more than 30 indications and contribute to improve the lives of nearly 700,000 patients by 5 new oncology medicines. The medical innovations extend lives if delivered to patients quickly. And this is where healthcare systems can improve. And regulatory procedures are lengthy, and regulatory frameworks are complex, and market access is very slow. So patients shouldn't have to wait for new and better medicines. So here, political decision makers could they make a big difference. Decision makers could also extend lives by promoting prevention and raising health awareness. And also that the digital transformation called DX, they could help to transform traditional healthcare system faster into the healthcare as a service ecosystem, where the patient with his or her individual needs stands in the focus. We at Daiichi Sankyo strive for total care, as you can see in this slide, an approach where health promotion, prevention, and treatment and prognosis are interlinked in each individual's life journey and improve longevity and healthier lives. And digital solution can play a major role in this area. And pharmaceutical industry also has the major role in total care in combination, in collaboration with other stakeholders. As you see below, that's the government and the insurance and then other the key stakeholders, and globally, not just in Japan. We are working on these models and expect them to deliver better health outcomes and happier the patients. So the art of longevity feeds on medical innovation, and it also feeds on international corporations. And this is my last thought. in our geopolitical situation, it's worth mentioning trusted, the partnership are more important than ever. And Daiichi Sankyo collaborates with our partners, and including pharmaceutical companies and research institutes globally. And as industry, collaboration, there has become the new normal to be innovative and bring therapies to patients faster and wider. So I'd like to close by saying only together we can help people live longer and healthier lives. And with that, we can strengthen the self-fueling ecosystem of health, longevity, and productivity, and wealth. And together, we can build strong networks, achieve faster innovation, and better healthcare. Thank you.
Thank you very much. And I really think about that your last slide and last thought summarized what we are trying to launch as a message today. We need cooperation among ecosystems and to foster these relations between Japan and Italy, from pharma, medicine advancements to research, and I hope maybe new collaborations between even Humanitas University, our cluster, the Kansai area, and also Daiichi Sankyo from the area to Italy will happen in the future, from basic research to clinical trials to co-investments on new startups that we are launching, as our Professor Fiorina told us before. So really thank you so much for being here and for presenting. I would go to the end of this meeting, the end of this first meeting, because we are already approaching our second step, which will be in June again, as we said before, on the 24th, where we will be talking about all the areas that we cover, from environment to technology to life science research to the healthcare governance. So thank you very much, hosts, and please have a seat again. And I would then go to the end of the meeting and leave the floor to Giampaolo Bruno, Mr. Giampaolo Bruno, Director of the Italian Trade Agency Tokyo, Italian Trade Agency partner of this event and of the future mission we are organizing with Assolombarda and the Italian ecosystem. Thank you so much.
Thank you very much indeed for having me today. Distinguished guests, esteemed speakers, ladies and gentlemen, it is with great honor that I will bring to a close today's innovation talk, The Art of Longevity, an event that has successfully blended strategic foresight, scientific excellence, and a spirit of international collaboration, as you were saying before. I'm sorry, I'm the final hurdle before your lunch, so I'll do my best to be as brief as possible, as smooth as possible. And first and foremost, allow me to begin by sincerely thanking Assolombarda and the Lombardy Life Science Cluster for their vision and outstanding organizational leadership. They have really created a platform where two of the world's most advanced scientific and industrial ecosystems, namely Italy and Japan, could meet and engage in meaningful dialogue. And today we have been very privileged to hear presentations that clearly outline the future potential of longevity as a new frontier of human progress. And Professor Paolo Fiorina guided us through one of the most pressing medical challenges of our times, type 1 diabetes. His work carried out within a center of excellence in Milan stands as a powerful example of how innovation can tangibly improve people's lives. We then explore avenues for enhanced Italy-Japan cooperation in the life sciences with Paola Vella representing the Lombardy Life Science clusters. We learned how life science hubs serve as a true innovation catalyst, united university, businesses, startups, and institutions around a shared vision. Dr. Ako Makiyama from the Osaka Chamber of Commerce and Industry enriched the discussion with a compelling call for a wellness-centric society, a vibrant model of active longevity in which health is not only the absence of disease, but is a full inclusive participation in life. And I enjoy her speech about the good nutrition and exercise to prevent disease, and also high yields for senior ladies to enjoy life even at a later stage. And finally, last but not least, Dr. Nagatomo Hamahata from Daiichi Sankyo brought us an invaluable industrial perspective, and his insights into oncology research pathways reminded us that transformative breakthroughs require vision, require investment and global alliances between private industry and public health. But all these contributions clearly show us that the collaboration between Japan and Italy in the field of life science is not only desirable but essential, I would say. It is not only the case of exchanging knowledge, but to build a future in which longevity be synonymous of quality of life, spread well-being, and shared progress. Yes, we know that also Italy enjoys a widely regarded leadership in life science thanks to an ecosystem of advanced research, pharmaceutical companies of excellence, and a health system capable of integrating technology and well-being. But this event is not only a showcase of results, it is only a starting point. What we need is to realize, to acknowledge that the future of longevity cannot be built upon isolated intuitions, but through a common vision and determination to creating a lasting impact. But I would also like to say something which may sound a little bit irreverent. Today, as we are here to envision a future where science stands both life and health, let us not forget that longevity begins at the table. I would like to remind you that under the Mediterranean sun, generations have lived longer and healthier, not through technology and pharmaceuticals, but through a simple, profound harmony between nature, food, and community. Let me also remind you that in the 50s, a famous physiologist, Ansel Keys, widely regarded as the father of scientific research on Mediterranean diet, during his groundbreaking 7-country studies, found out that in southern Italy, populations following a traditional Mediterranean diet rich in fruits, vegetables, legumes, whole grains, olive oil, and moderate wine consumption had remarkably lower rates of coronary heart disease compared to population in Northern Europe or the US. And this is also why UNESCO has recognized the Mediterranean diet as immaterial cultural heritage of humanity. But let me come to a conclusion. Today we planted a seed It is now up to us to nurture through concrete projects, through bilateral agreements and joint research initiatives. Expo Osaka, of course, and I thank you very much, the Italian Pavilion and Commissioner Vattani for hosting us today, offers indeed a unique stage to solidify this alliance, and Italy is fully committed to playing a proactive and forward-looking role. And let me close with a wish. Longevity may not only mean more years of life, but more life in every year. And that through our collaboration, it may become a new engine for sustainable and inclusive development. Thank you very much indeed for your attention, your insights, your commitment, and your shared vision. Thank you.
Thank you very much, Giampaolo, and thank you to the audience, to the attendees, to the people watching from the outside of the Italian Pavilion, to the people connected to the streaming. This is just the first innovation talk. We will be here again in the end of June for the Agevity Forum, the third edition, international edition of a first Italian forum about longevity, which this year will be Italian-Japanese Forum. And thank you again very much for attending, and we really wish to increase, as Giampaolo Bruno told us, years to life and life to years, also through this first and hopefully one of the longest cooperation between our countries. Thank you very much. Facciamo una foto. I just ask to all the speakers if you want to come to the podium to have a picture together.